So you know what Medicare covers, but what about what it doesn't cover? That's what catches people off guard. I'm Adrienne, a licensed Medicare agent, and today I'm breaking down the biggest gaps in Medicare's coverage and showing you exactly how to fill them. Because knowing what's not covered is just as important as knowing what is. Original Medicare, that's parts A and B, is solid for hospital stays and doctor visits. But here's what it doesn't cover: routine dental care, vision care, hearing aids, long-term care like nursing homes, most prescription drugs, care when you travel outside the U.S., and cosmetic procedures. These are the gaps that surprise people the most. Let's start with dental. Medicare doesn't cover routine dental care at all. That means exams, cleanings, fillings, dentures, implants, none of it. If you need dental work, you're paying out of pocket unless you have separate coverage. Same thing with vision and hearing. Medicare doesn't cover routine eye exams or glasses unless it's related to a medical condition like cataract surgery. And hearing tests and hearing aids, not covered either. So if you're wearing glasses or need hearing aids, that's all on you. Here's a big one that confuses people: long-term care. Medicare does not cover custodial care. That's daily help with bathing, dressing, eating, or other personal needs. If you need ongoing assistance at home or in a nursing home, Medicare won't pay for it. This is one of the most expensive gaps people face. And prescription drugs, most medications you pick up at a pharmacy aren't covered by Original Medicare. You need a separate Part D plan for that. So if you're taking regular medications, don't skip Part D, or you'll be paying full price at the pharmacy. So why doesn't Medicare cover all this stuff? Because Medicare was designed for short-term medical care, treating illness, injury, and preventative screenings. It wasn't built for ongoing routine services or long-term support. That means you need extra protection to cover those gaps. The good news, you have options. First option, Medigap plans. These are Medicare supplement plans that help pay the costs Original Medicare leaves behind. Things like deductibles, co-insurance, and co-payments. They're sold by private insurance companies, but they work right alongside your Parts A and B. I've seen how valuable these can be. I had a client who was hospitalized for an appendix removal and ended up in the ICU with complications. Because he had a Medigap plan, it paid the full 20% that Medicare didn't cover. That saved him thousands of dollars during an already stressful time. Second option, Medicare Advantage. These are Part C plans that combine Parts A and B into one plan. And here's the bonus. Many Medicare Advantage plans include dental, vision, and hearing coverage that Original Medicare doesn't cover. Most also include prescription drug coverage. This can be a good choice if you want everything bundled together in one plan with lower monthly premiums and those extra benefits built in. Third option, Part D drug plans. If you stick with Original Medicare, you'll need a standalone Part D plan to cover your prescriptions. Every plan has its own formulary. That's the list of drugs they cover. So compare plans every year to make sure your specific medications are included. Don't just pick the cheapest premium. Pick the plan that covers your drugs. Now, how do you choose between these options? It depends on your health and your budget. Some people want a Medigap plan for predictable costs. Others like the convenience of Medicare Advantage bundling everything together. Look at how often you see doctors, what prescriptions you take, and whether you need dental or vision care. That'll guide you to the right choice. Here's what to remember. Original Medicare doesn't cover dental, vision, hearing, long-term care, or most prescriptions. Medigap, also known as Medicare supplement plans, helps with deductibles and coinsurance. Medicare Advantage adds benefits like dental and vision. Part D covers your prescriptions. And comparing your options early helps you fill those gaps before they cause financial stress. If you found this helpful, subscribe for more Medicare breakdowns every Tuesday and Friday. Thanks for watching, and I'll see you in the next one.